Welcome to Peterloo's Daily Dose, where we bring you the latest insights, stories and conversations shaping the future of general practice and primary care.
Right, Darren, welcome to this podcast. Thank you. What's your role within Middleton?
So I'm Social Prescribing Link Worker. I was originally working with children, now cover children and adults. I also have project working with local schools to offer support interventions for students within the school setting.
What aspects of work is it with the children that we want to focus on today?
So I believe we're going to speak a little bit about ADHD
Okay.
and how we support. So initially, my referrals will come through the GP practice, sometimes from the SEND workers in school or pastoral team. And then looking at how we meet a child's needs and give them the support that they need, whether that's home setting, school setting, and social setting. So initially that will start with referrals going into CAMS, get child onto the waiting list, firstly if they meet the criteria.
Before we go that far, what's the scale of the problem? Let's take Middleton for a start.
Yes. It's predominantly my referrals. I'd say it's a huge representation in my referrals.
Okay.
I think a big struggle that families are having is trying to get school and everybody to work together, see that there is a need for the child, get the referrals made and get them onto that pathway.
How do these children present in the system? Is it usually the parents come forward, or is it something that the teachers raise in school? Because how long have you been going into schools now?
2 years been working in schools, and here weekly clinic in schools.
So you've built up a relationship with the staff in school, educational psychologists, the teachers, and it's a number of schools in Middleton that you've been covering.
That's right, yeah.
And then based on the children being in school, they would book into your clinic.
So yeah, a lot of the children that are on the pathway at the moment, I will meet with weekly. And that's just so a lot of the children have things in place such as that individual education program. And I'm a big believer in trying to get things like that set up as soon as possible, working with schools, parents to work with what the needs are and how they meet it. The pathway can be such a long time. So a child could be in school for 5 years. It might take a year for school to notice and pick up that there's a need. They then start the process of making referrals. It could be well into a second term. Once if CAMS think that they meet the criteria, they then go onto a waiting list. That could be another 2.5 year process.
So from what I understand, previously in Rochdale Borough, we used to have a service provider that suspected ADHD cases will go to.
Yeah.
There was an issue with the provider, whatever the issue was, and their service got terminated. Over the past few years, we've really not had a service provider, which has led to parents really struggling with children who are suspected of having ADHD.
Yeah.
The GPs have been stuck because we don't have a service to refer into. And frequently, we've had parents coming along saying that they want to be referred to a private service.
Yeah.
And unfortunately, it's extortionately expensive to have both children and adults referred into these private services. And it's amazing. Across the country, these service providers who do ADHD assessments have cropped up all over the place. And when you think they've been charging on an average £2,000 to £3,000 per assessment, and some of these are not even face-to-face.
Yeah.
These are done over the telephone, over the computer. In some cases, we found out it's not even doctors that are doing the assessment. It's nurses doing the assessment. And then there's recommendations coming back from the nurses to the GP saying, can you initiate this medication? And unfortunately, the GPs can't because the request is coming from somebody who can't prescribe themselves. Also, some of the medication we use for ADHD is what we define as amber drugs. And amber drugs are drugs that GPs can't start. They have to be initiated by a specialist. And once the patient is stable on that drug, the GP is then asked, would we take over the care and prescribe for that patient. Well, if it's a nurse that's doing the assessment, they can't initiate a drug. We can't get into amber drug issues. So there's many examples I've come across in clinic here at Peterloo Medical Centre where we've been asked by parents, could you refer us? Could you do a letter? Because we want to go and see this person privately. But the problem is that the authorities have told GPs that anybody who goes and has a private assessment done, we are not to prescribe for them.
Yeah.
And if they go privately, then when the NHS sets up a service, they can't be referred back into an NHS service as well, which just seems like the parents have been stuck in a corner, not knowing which way to go. Have you come across that in schools?
I say it a lot to parents that want to explore that right to choose pathway, that you need to be very careful about what you decided to do there. I've worked with parents and families that have chose to go down that avenue, get a diagnosis, like you say, that's not from somebody that should really be given a diagnosis. It's not recognised by the school, it's not recognised by the NHS. The parents then wasted however many thousands of pounds, and they're told then that they have to go back on a CAMS waiting list to start any medication or anything like that has to go for a child psychologist, which is going back onto a waiting list of CAMS. So some parents that have paid for the service themselves then get forwarded back to the same process of what they were initially trying to avoid. And it's, be careful what I say. I think there's people that have exploited the market where they can see parents are really struggling, vulnerable, and they're desperate for support and help. And if, as you said, there's a lot of companies that are popping up that are providing the right to achieve.
The problem is that where diagnostic blood tests need to be done, because these companies are so far away, they can't arrange blood tests, heart traces, any other diagnostics that are needed. And they're relying on the GP to arrange those tests. But we're not the specialist service.
Yeah.
If they need tests to help them initiate therapy, they need to arrange it.
Yeah.
And therefore the parents, the child is then left in this kind of difficult situation of, we can't start the treatment without these tests, but the GP won't arrange the test because that's not within their forte. The bit I think we need to clarify here is this thing about exercising choice. In the NHS, where we have a straightforward referral pathway, the same as, for example, if you presented with a heart problem or a breathing problem or a bowel problem, and we refer you to a heart specialist, a lung specialist, a bowel specialist, we would refer it to the local hospital in most cases, and you get an outpatient appointment to go and see somebody. Within ADHD, and this is right across the spectrum, patients legally have a right to exercise choice. Now, there's a difference. Where you exercise choice, you have the right on the NHS to find an NHS-approved service provider who will provide a service on the NHS at no cost to the parents, but that service has to be NHS-approved. Yeah, which is very different to a parent coming along saying, I'd like to go and see this person privately that I found on Google or has been recommended to me. And then you end up paying £2,000-3,000 for the initial consultation. And who knows how expensive it's going to be for follow-ups as well. So yes, parents can be referred. The system, as I know, and correct me if I'm wrong here, if somebody is referred, they are initially assessed by the educational psychologist in a school setting.
So not always. That can happen later on down the line, but initially the referral that's put in place should meet some criteria that identifies them as a need. The child will then wait to have further meetings and assessments with CAMS where child psychologists will spend some time.
But who does the referral to CAMS? Does it come from educational psychologist yourself?
So I do the referral into CAMS after consultation with the family and the school at times. My belief is the best way to go around it is this way. It's going to be a bit longer, but that's where the work that we'll do comes into place. So once a child's on that pathway and in the system, we then need to look at the support, because this is going to be a couple of years or 2 years process.
Okay.
So that's collaborating with the school, making sure send passports, IEPs are in place and that child's needs are met within school. Looking at how we support a family in the home environment, whether that's through services such as Home Start, children attending in families going to neurodiversity hub, and then the social aspects where anything that the child needs social out in the community.
Do you tend to help facilitate
That's
okay?
What I class my job is to do, is to make sure that that full wraparound support is in place.
Okay.
Let's say that we collaborate with school, we're supporting the child in school. We're collaborating with the family and making sure that the family have got all the support they need of outside agencies, and that the child's got support, whether that be activities, social groups.
And when there's a suspicion, not a diagnosis, but a suspicion, do you tend to find that the school adapts the classroom environment to help them, or is there a barrier there?
Yeah, so the schools I work with are amazing. And a lot that I don't run clinics in, but still collaborate with and work with. They're really based, yeah.
Okay.
And that is all something that I go into their IEP or their passport, and that is certain things that are put into place to try and help the school, try and help the child manage in their education setting. So that could be things as simple as they have 5-minute passes, somebody can leave the classroom earlier, they're not having to walk the corridors where every child has. Yellow passes, green passes. So if a child's feeling a little dysregulated in the classroom and overwhelmed, they can put their card on the table.
Okay.
They'll have the chance to go on 5-10 minutes out of the classroom just to regulate. Go and seek some support. That may come speak to myself, go speak to the send worker. And these are all things I think that are proven to work, is in giving a child 5 minutes out of the classroom sometimes can be better if they can come back in regulated and ready for work.
Sure.
If a child's not ready, they can sit in the classroom for 2 hours and nothing's going to be retained and nothing's going to be taken in. So sometimes these little measures and little things that we can put in place can have a big improvement to their education. The main thing, I think, there's a huge percentage of children that have ADHD or suspected that disengage, start to not attend school and really struggle with attending school. So my belief is that we want to do everything and put everything in power that we can to try and keep children in education.
Based on, you've been going to school now for 2 years, your observations in an average class of, let's say, 20 students, how many would you say have ADHD or a suspicion requiring referral?
I'd say there must be at least 2 or 3 in saying that.
In every 20.
Yeah,
which is quite a lot, really.
It is quite. I think you can read on symptoms, and a lot of people can probably attach to it and think, actually, I'm a little bit like that. So that's why I always say going through CAMS and through child psychologists is the best way, because once they have their formal assessments, it will identify and will only pick up a child that does have those needs.
So based on, let's say, parents, there's some behavioural change with the child, or concerns about behaviour. Where should the parents go initially to look into whether the symptoms, the signs that are presenting, could they be ADHD or could it be something different? Is it Google Doctor? Is it somewhere else? Where did they find out the initial information?
The NHS website will give you a basic breakdown of things to look out for. If you think that child's present with a lot of those symptoms, I would recommend your first point of call is to go to school, speak with the SEND worker or your child's teacher, and ask them to refer over made to the SEND or SENCO department. That they will then look into it a little bit further. They'll correspond with the teachers that engage with the child and try to establish if they're picking up on any needs, if they noticed anything. Once that's sort of been established, if they're all in the same agreement that child does, there might be something that's underlined here. We want to, examine and look into it a little bit further. The school normally will make the referrals. A lot of the time, that doesn't always happen. And I think that's why they come to the GP practice. But I think it's important to say it's because I know schools get a hard time with it, but a high school can have 1,000 students in there. And if we're talking in a classroom, 2, 3 students of every classroom that presenting like that, there's normally one SEND worker that's in charge of dealing with the whole school's SEND needs. And that won't just be for ADHD and autism. That could be for a number of additional needs. So sometimes it's hard for a school to pick up on it very quickly. Referrals, everything's submitted. A SEND worker has so much on their plate to do in school.
And the thing for GPs in Rochdale Borough is that we have been informed that the correct process is for the educational psychologists or the system within schools to do the referral to a CAMS team.
Yeah.
Not for GPs to refer into CAMS.
Yeah.
Where there is a suspicion of ADHD.
Do you feel it defeats the point? Because once I make the referral, if CAMS see feedback what I put in the referral and what the parents discuss meets a threshold, they are always going to send paperwork to the school for the school to have their input.
Okay.
Any child that suspects of ADHD will show presentations in more than one setting, so it wouldn't just be the home setting, it would be the school setting as well.
Okay.
So CAMS are always going to want schools to have an involvement. So either way, school will have to fill in some paperwork and have their input anyway.
Now, over the past couple of years, we've worked together, and I've had a lot of feedback from parents about the service you provide. And I think one of the kind of key things I picked up where there's a good relationship built up is the child asking the parent that can they make contact with Darren? I want to go and talk to Darren, which to me says that the bond you've built with that child is a strong one, that they have the confidence to go to their parents and say, I want to speak to Darren.
Yeah.
And they then open up to you. Mm-hmm. Do you find that they open up quite freely with you, or do you find that there are challenges in terms of them not expressing themselves? And if so, how do you get over that?
Mixed bag, Rich. So a lot of children have been really open. I've worked with for years. I have a trusting relationship with them. A lot. It just takes time, I think, because some children have experienced and gone through some things where they might feel failed or let down or not always got what they need. So I can understand this as an outsider and someone that's not known, so it's hard for them to probably put the trust in people sometimes, and they might think, well, are you really going to help me? Are you there for me? So I think with a child or a young person that might present like that, I think it's just that continued work. Meeting with them every week, checking in on them, letting them know that I'm here. You can come and speak about anything and discuss anything. And when I meet a child, one of the first things I always discuss and make it clear to them that I'm not here for the benefit of anybody else, whether that's the GP practice, the school, the parents. I am here for you, what's important for you and what you need. I'll always do what most to try and support and help you with right thing and advocate for you and that your voice is heard.
Yeah.
And I'm neutral. So anything you want to discuss, you can discuss and I'll support you with that.
Previously, over the past 2 years, you used to support children from any of the GP surgeries in Middleton. Over the past few months now, you're focusing only on patients registered with Peterloo Medical Centre.
Yeah.
So any child in a school that's registered with Peterloo Medical Centre, you would be point of contact.
Yeah.
Where they are not registered with Peterloo Medical Centre, presumably they have to rely just on the school system and for them to do a CAMS referral.
Yeah, that would be the case.
Would they get the wraparound package that you talked about previously, or would that be difficult?
I think they'd still get the support and obvious. My background's from child, so I'm quite aware of Child Protection Act and how we need to support children. So, because I run a drop-in the school, if a child come and presented that even wasn't under our GP practice and they disclose what they were struggling with, my point of call would always be to raise that with the school. You make recommendations if your child is struggling with X, Y, and Z.
Okay.
I wouldn't be able to do referrals and all that added stuff as I don't have access to medical records, personal details, parents and families information that we need. So with regards to me taking, I would be able to do all of that extra work now.
So your base is here at Peterloo.
Yeah.
You still visit the schools in Middleton.
Yeah.
Is it every fortnight now?
Every fortnight, yeah. Since starting to work with adults, I do a week in schools and a week for child clinics and a week for adults clinics.
Okay. And I know recently I've just seen some paperwork across Greater Manchester. There is an expression of an interest request gone out because they are now looking for a new service provider to triage children and adults who are on a waiting list. I think last year I was informed there was some like 20,000 children on a waiting list for an ADHD assessment. And I think it's about the same for adults as well. So who knows how long it's going to take for a new triage service to get through that many.
There's these cans about it, because I did read the same myself. But I think even the cancer workers were not sure how they say, they know it's this new triage service based on priorities and needs is coming into play, but we're not fully aware of what criteria is, how we triage and that. So,
and the thing is with mental health, not just ADHD, with mental health overall, it's a spectrum of presentations that you get. It's not like I do a full blood count on somebody.
Yeah,
I can tell based on the number I get how anemic they are.
Yeah.
Well, in mental health, you don't have a number, and therefore, I suppose the triage service is there to gauge the severity of the presentation, the symptoms that they have, to make sure that those that proceed on to an assessment for a diagnosis are the more severe end of the spectrum.
Yeah.
Rather than finding the severe end are sat at home with no access to services, and yet the mild ones are getting through purely because they got onto the waiting list sooner.
Yeah.
So the triage is there for a genuine reason to make sure that those with the most need get the help sooner, and the others either may be deferred back to the GP with guidance and advice, or to a community and mental health service, or they might be seen later on. Who knows how long later on is going to be.
You hit the nail on the head with that as well. It's so interpretive. So I know paperwork and assessments that can be done because it's not a definitive 2 + 2 is 4. So I read that and think a child's at a certain point and meet certain criteria, where another worker could read it and maybe interpret it a little bit different. So it's, although a child that's presenting the same issue, 2 different people reading the referral and what's being put here could be seen different as well.
But it's further on, further before that, because 2 patients reading a question could interpret it differently.
Exactly.
Same severity of pain for me and you, and yet you might gauge it as pain 7, 8.
Yeah.
I might gauge it as 10, for example. So yeah, it's the same pain. It's how we perceive the question that's been asked. So it could be judged very differently. So we do need something with the scale of the problem. We do need something that is going to highlight those with the greatest need and not just work from number 1 down to 20,000. And remember, day on day, we're getting people be added to a waiting list because people are still presented to schools, to the GP. Unfortunately, we have got a service that is as responsive as we'd like to.
It's huge overall. I think with ADHD and things such that it presents a long-standing issue because statistics show that children that have a diagnosis of ADHD are hugely represented in the mental health service when they become adults. Huge overrepresentation of self-harm and suicide, a huge overrepresentation in the prison systems, a huge overrepresentation with addictions. So I understand we're overrun at this level, but the strains it puts on services as these young people become adults are huge still. So it's something doesn't need to be put in place down here to try and combat as that child moves into adulthood the resources that it takes from services and the money that's input in as they become adults and that. So we always say early intervention is key, isn't it? Prevention's better than cure.
Yeah, there's a perception issue here as well. I had a consultation earlier this week, and it was to do with a teenager, older teenager who's at university, and the person's taking time off work due to mental health reasons. And the parent rang me up and expressed concerns and said, I think she may have ADHD. And yet, if I ask the average person on the street, their perception would be that ADHD must be related to people who are non-functional or struggle to cope with daily chores, and they don't realize that you can still have people in jobs, high-paid jobs, kind of professional jobs at university, and yet they can still have ADHD.
Huge high achievers. It's one thing I have a child that's neurodiverse, attending the same a lot. And I saw it's only child that I do need, that there is nothing bad with getting this diagnosis, and it's not going to hold you back, and it's not something that you need to be ashamed of or feel that you can't achieve. I'm very big in showing children, people in the public eye that are neurodiverse, that have achieved great things, that have done some of the best things for what we all use and all benefit from. And it's important that children know that as well, that although they might struggle sometimes, they can still achieve their dreams, they can still reach their aspirations. But it's just about how we support them on that way and through that path.
And with the right support and treatment, they're going to function better.
Yeah.
They're going to develop and move forward quicker, which is great. So you've got clinics here at Peterloo.
Yeah.
And you do school visits as well.
Yeah.
And through the week, you're accessible anyway.
Yeah.
So what do you think the next kind of development is in the pathway beyond triage for you? Is there something that you're aspiring to?
I love, as you know, you've known me for so I love the work that I do with children. Absolutely, I'm hugely passionate about. I know there's probably people that are more qualified than me, but I don't think there's many more I'm more passionate about, and I'll advocate and always do my best for any child or any family. So I really want to maintain the work that I do in schools, and that work that I do with children. I love that, being with children, being able to support one-to-one, not just through outside agencies and other services. I have a real passion for, I've always wanted to work with young offenders. There's a huge correlation for children that are ADHD, that disengage from school, that then go on to pathways of young offending. I think within the prison system, there's a huge percentage in there. So I'd really, really love to be able to do something with that in the future. But yeah, I think at the moment my time's quite taken up. Anything I could do in my community that's based with children, I'm always up to help or support with, and that's my great passion, really. Yeah.
Well, generally for the doctors here, doctors around the country, in a 10-minute consultation, it's very difficult for us to do that assessment, build the relationship, the bond. And so I know the doctors at Peterloo here are grateful for the support you've provided, and we feel like we've supported the parents and the child that comes to us, and the older people as well, who come to us with a suspicion, because we've had you to refer to, and you can provide that time, the insight, the support that's needed. And, we've not been left unsure of where do we refer you to, who do we send you to. Yeah. There's no service that we can refer into. So you've been a great asset to the doctors at Peterloo, and we're just grateful that you're going to carry on providing a service here at the surgery.
Thank you.
So thanks for that.
It's a lot, so thank you. I appreciate it being here.
So.